Hello and welcome to another segment of DSU Inside Perspective. I'm Carlos Holmes, and this is the show where we talk with faculty, staff, students, and guests about some of the things that are going on in the world or some of the great things that are going on here at Delaware State University. What we're talking about today, whether it's great, depends on who you are and how it impacts you, but I think it's probably pretty healthy. We have a new smoking policy that will take effect in 2015, and I've asked Marianne Carter, who is the director of the Delaware Center for Health Promotion at Delaware State University, to come on and let's talk about this a little bit because you were a part of this conversation.
Absolutely.
Things are not getting any easier for smokers out there. It seems like it's harder and harder for them to enjoy their tobacco products in public. Talk to me about what is this new policy? How's it going to take form?
Well, as of January of 2015, there will only be 4 specifically designated and marked areas on campus where people can light up.
And has that been decided which areas?
That is still under debate. Okay. I thought it was decided, but we've had a little bit of discrepancy. So, but it will be decided soon and advertised. And then after August 15th of 2015, people will need to physically remove themselves from campus in order to smoke. We will be entirely tobacco and smoke-free.
Now, will this include the Kirkwood facility up in Newcastle County?
Absolutely. Any other satellite campus, there will be 1 designated smoking area between January and August 15th. During that period, they can smoke in their car, their personal vehicle, but after August 15th, they will need to physically leave the campus.
This encompasses e-cigarettes too?
E-cigarettes are included. The evidence is still not conclusive about the ingredients in the vapor that is emitted, and some studies are showing that it is equally as harmful.
Secondhand smoke. I think the evidence is pretty solid, but talk about that. I mean, some people still need convincing.
Right. If a person thinks that their rights are being violated, the response could be that it's your choice to smoke, but we know that what comes out of the smoker's mouth can actually impact the person who is in proximity to the smoker. So secondhand smoke absolutely is dangerous. It contains equally as toxic, if not more toxic chemicals. It's not filtered in the same way that it is when it goes into the smoker's lungs. It's coming out, and the person doesn't have that filter. So it is definitely dangerous. And asthma can be triggered. I mean, there are a whole host of things.
Now, this is a policy that's going to take an effect, and at some point, no smoking whatsoever. Has there been penalties, decided upon?
Well, initially, we're going to ask people to politely remind others that we are a smoke-free and tobacco-free campus. But if either students or employees continue to smoke, yes, there will be some type of repercussion, which is being discussed right now. In the same way that, you go through academic judicial affairs. Absolutely, yeah.
Okay.
Yeah.
What is DSU doing to help the smoker? Let's say the smoker really wants to quit, but they're having a hard time doing it. Are we going to reach out to them in some way, shape, or form?
I actually have been for the past couple of years. And there are several employees who have come to me and received individual counseling to quit smoking and have been very successful. So that will continue if employees or students are interested. We have wonderful resources as well within the state of Delaware. The Delaware Quit Line, easy number to remember, 1-800-QUIT-NOW, offers free telephonic support, and depending on income, they may also offer tobacco cessation aids like nicotine gum and patches and even medication based on income.
Now, I'm an ex-smoker. And it wasn't easy to quit, but I did it. You're ex-smoker.
Absolutely. 17 years.
17
Best
years?
thing I ever did was to quit smoking.
Talk about the cost of smoking in terms of money or health risk?
Okay, well, to me, the health risk is more important than the money, but sometimes people need that as a motivator. If you smoke a pack a day at today's prices, which average $6.50 a pack, you are spending $2,400 a year in cigarettes. So if I came up to you and said, over a 5-year period, you know, would you like to have all of this money, over $10,000, you would be like, absolutely. That's what you could have had you decided not to smoke. The health implications, tobacco and cigarettes, it's the only product that when used effectively can kill you. Almost 500,000 premature deaths occur every year as a result of cigarette smoking. And if the smoking rates don't decline from the current level, 6 million of our children who are going to grow up and start smoking are going to die. 6 million. Tobacco industry is smart. It adds nicotine, which is an addictive substance. It makes it hard to quit. It's targeting our youth. We really need to step back and think about, do I want to do this to my health? Lung cancer, everyone's aware of. Heart attacks, something that, you know, cigarette smoking absolutely will lead to.
Is there a point of no return for smokers where it's just...
Absolutely not. There are many people who think, oh, I've been smoking for 40 years. You know, what's the use in quitting now? Your body is incredible. It will start repairing itself as soon as 20 minutes after your last cigarette. And after 15 years, you will be at the same health risk level as a non-smoker.
And this is why I lifted this up here, because this is compelling stuff here. It talks about the impact of quitting. And it talks immediately, 20 minutes after you quit smoking, your blood pressure improves.
Yep.
You know, 48 hours, your sense of smell and taste improves. 2 weeks after you quit smoking, your heart risk decreases, your heart disease risk decreases, and your blood circulation improves. And it goes on and on, 6 months, 5 years, but your health does improve once you quit smoking.
Absolutely. And one thing that I think is important, a lot of women in particular fear that they're going to gain weight if they quit smoking, and that does happen because nicotine speeds up your metabolism slightly. But the 10 to 15 average pounds that a person will gain can be easily lost. And the health risk associated with continuing to smoke is far, far greater than carrying around an extra 10 pounds. So.
Well, it sounds like this new policy will become reality here at Delaware State University. So those that still smoke, I feel for you as an ex-smoker, but maybe this would be a good motivation to quit smoking.
Absolutely. And November 20th, if people are watching it before then, will be the Great American Smokeout. It's something the American Cancer Society does annually. More people than any other date quit smoking on that date.
Okay, so. November 20th. Marianne, thank you so much for being on the show.
Sure, thank you.
And thank you for joining us for another segment of DSU Inside Perspective. Have a good day.